Does your skin turn red easily? Do you notice a sensation of heat, a burning sensation, spots that look like acne, or visible red veins on your face? Have you ever been told you have sensitive skin, but you feel there's something more to it? We might be talking about rosacea. And no, rosacea isn't simply having red skin, nor is it a lack of hygiene, it isn't contagious, and it isn't always acne. Today I'm going to explain in simple terms what rosacea is, how to recognize it, what tends to make it worse, and what we can do to manage it. I'm Dr. Goretti, a dermatologist, and I welcome you to Happy in My Skin, a space to better understand your skin with honest, easy to apply medical information. Because your skin doesn't have to be perfect to be healthy, and understanding what's happening to it is the first step towards looking after it better. Rosacea is a chronic inflammatory skin condition that mainly affects the central area of the face: cheeks, nose, forehead, and chin. It can manifest in various ways: persistent redness, flushing, a sensation of heat, burning or stinging, inflamed spots, visible broken capillaries, highly reactive skin, eye discomfort. And here's an important point: not all rosacea is the same. Some people mainly experience redness, others have spots, others feel a lot of burning, and some experience eye symptoms. One of the most common misconceptions is thinking that rosacea is acne, and they do look similar, but they are not the same. With rosacea, there may be red spots or pustules, but we don't usually see comedones, that is, the blackheads or whiteheads typical of acne. Furthermore, skin with rosacea tends to be more reactive. It may burn, itch, or turn red with products that other skin types tolerate perfectly well. And this is important because treating rosacea as if it were acne can further irritate the skin. You may suspect rosacea if you notice one or more of these signs. First, redness on the cheeks, nose, forehead, or chin that comes and goes at first but lasts longer over time. Second, episodes of intense flushing, for example, due to heat, alcohol, spicy foods, exercise, or stress. Third, a burning, stinging sensation or skin that feels on fire. Fourth, inflamed spots that look like acne but without blackheads. Fifth, visible broken capillaries, particularly on the cheeks or nose. Sixth, red, dry eyes, a gritty sensation, irritation of the eyelids, or a feeling of recurring conjunctivitis. Rosacea usually affects the face and may include flushing, persistent redness, acne like lesions, visible blood vessels, skin thickening, or eye symptoms. Eye involvement may include blepharitis, conjunctival hyperemia, or rosacea associated keratitis. The exact cause of rosacea is not fully understood. However, we know that several factors are involved: skin that is more prone to inflammation, more reactive blood vessels, a compromised skin barrier, individual predisposition, environmental factors, and in some cases, a higher presence of a mite called demodex, which normally lives on the skin but may be involved in certain inflammatory conditions. The important thing to understand is this: rosacea does not appear because you don't clean your face properly. It's not your fault. It is a real, common, and treatable medical condition. It is not dirt. It is not contagious. It is not your fault. A key part of managing rosacea is identifying the triggers. They are not the same for everyone, but there are some very common ones. The most common are sun, heat, sudden changes in temperature, alcohol, spicy foods, very hot drinks, intense exercise, emotional stress, irritating cosmetics, harsh exfoliants, corticosteroids used on the face without medical advice. But be careful. It's not about living in fear of everything, it's about observing patterns. A practical tip: for a few weeks, note down when you have flare ups and what happened beforehand. Often the trigger is the same: sun, alcohol, extreme temperatures, hot drinks, spicy foods, exercise, and stress are consistently described as common triggers. It is also recommended to avoid irritating products. If you have rosacea, your routine doesn't have to be complicated. In fact, often the simpler, the better. Three pillars: 1. Gentle cleansing. 2. Restorative moisturizing, a cream that supports the skin barrier and doesn't irritate. 3. Daily sun protection. Sunlight is one of the major triggers of rosacea. Gentle cleansing plus moisturizing plus sun protection. And a key point: if your skin stings when you apply lots of products, it doesn't mean they're working. It may mean your skin is irritated. With rosacea, less can be more. The good news is that rosacea can be managed. We can't always cure it completely, as it's usually a chronic condition, but we can reduce flare ups, redness, spots, and burning, and significantly improve quality of life. Treatment depends on what symptoms are most prominent in each person. If inflammatory spots are the main feature, we can use topical treatments such as azelaic acid and, in some cases, oral antibiotics at anti inflammatory doses. If persistent redness or broken capillaries are the main feature, topical vasoconstrictor treatments may help in selected cases, as well as technologies such as vascular laser or intense pulsed light. If there are ocular symptoms, an ophthalmological assessment may be necessary, as rosacea can also affect the eyes. Let's look at some very common mistakes I see in my practice. Mistake number one: using very strong exfoliants because there are spots. Rosacea does require cleansing, but it does not need harsh treatment. It requires control of inflammation. Mistake number two: using too many active ingredients at once, potent retinoids, acids, vitamin C, scrubs, toners, on skin experiencing a flare up. This can worsen the burning sensation. Mistake number three: self medicating with corticosteroids on the face. They may improve the condition initially, but can later cause a rebound effect or worsen the rosacea. Mistake number four: thinking it's all about cosmetics. Cosmetics help, but rosacea is a dermatological condition. Mistake number five: giving up too soon. Many treatments take weeks to show improvement. Rosacea isn't managed by covering it up with more and more makeup every day. It's managed by understanding what triggers it, repairing the skin barrier, and treating the inflammation properly. And this completely changes your relationship with your skin. Consult a dermatologist if the redness lasts longer and longer, you have frequent flare ups, inflammatory spots appear, you experience intense burning, you can't tolerate almost any product, you have red, dry, or irritated eyes, or if you've used corticosteroids on your face and your skin has worsened, and especially if you experience eye pain, blurred vision, or marked sensitivity to light, as medical assessment is advisable in such cases. If you have rosacea, I want you to take three things away from this. Firstly, it's not your fault. Second, it's not just about appearance. Third, it can improve significantly with the right approach. In the next videos, we'll discuss routines for skin with rosacea, ingredients that can help, ingredients to avoid, medical treatments, laser therapy, pulsed light therapy, and ocular rosacea. If this video has helped you, subscribe to Happy in My Skin and leave a comment telling me which topic you'd like us to cover first. A basic skincare routine, rosacea and laser treatments, rosacea versus acne, or what to do when your skin stings with everything. See you in the next video. And remember, understanding your skin is also a way of looking after yourself.